Shortages of medicines and vaccines is a key issue internationally with negative consequences on patient welfare, but also costs of care. So what we are trying to do in this project is to identify and evidence cost-effective measures for improving the availability of medicines and vaccines. Specifically, we are looking at supply chain related interventions such as better procurement systems, better inventory management systems, and reshoring of production. So better understanding of how these supply chains are structured and how they operate can generate important insights in relation to several areas where the NHS and the Department of Health and Social Care focus on at the moment. I'll just give you two brief examples. The first example is about supply risk management and how to improve supply risk management. So mapping and analyzing these supply chains can actually expose vulnerabilities and risks and identify opportunities to mitigate these risks. So a quick example of that is that there might be over-reliance on specific countries or specific supplier firms as sources of active pharmaceutical ingredients. The second example is an example about better procurement systems. So the current NHS tendering and contracting practices focus very much on price and cost efficiency, which in some instances can actually exacerbate supply issues when market authorization holders drop out of the market or when they underinvest in their supply chain operations. So ways to fix this problem would be to increase the prices or even have in place supplier selection criteria that prioritize supply security. For example, these suppliers can actually invest in buffer stocks, or they can actually have multiple sourcing strategies so that they have security in terms of the supply of the active pharmaceutical ingredients or other raw materials. So our work on medicine supply chains is still ongoing. Therefore, it's perhaps more relevant to talk about pathways to impact. One specific and important pathway to impact is that we are working very closely with the Department of Health and Social Care, specifically the medicine supply branch, and we are helping inform their policies regarding how to increase supply security. So that we are informing their work, for example, in strategic stockpiles and better procurement. It is imperative that research makes a difference in the real world, and this is also in line with the vision of the school and the Lancaster University more generally to produce research that is impactful. Just to give you an example, our research on medicine supply chains can actually help deliver benefits for multiple stakeholders. Patients can get access to their medicines on time. NHS trusts and community pharmacies can reduce the time they spend and the effort they put into sorting out alternative products or alternative sources of supply. And for the NHS and the taxpayer, it's very important because it can reduce the costs of care, specifically related to postponing or cancelling treatment because of medicine shortages.